SLI in the past that they didn't have a really good, they had forgotten what their 8th grade civics lesson taught them. So my apologies if you are a guru at U.S. politics. This will be a little bit monotonous for you, but for those of you that just need a primer on what's going on in D.C. and how legislation works, this will be a quick overview of that. There are 2 houses of Congress. One is the House of Representatives and one is the U.S. Senate. The House of Representatives is made up of 435 members. You have 1 member of Congress, so you have 1 House member. The Republicans have the majority in both the House and Senate. This is a breakdown of where those members fall on party lines, and you see that there's 218 needed and votes needed in the House for a majority. Next slide, please. This is a Republican leadership in the House. Most commonly, you will hear Speaker Paul Ryan's name mentioned. The Speaker is the leader of the House of Representatives. Next slide, please. This is the minority leadership, the Democratic leadership, and they are led by Congresswoman Nancy Pelosi from California. And this is the remainder of her team. There are 2 main committees. There are lots of committees in the House and Senate, but there are 2 main committees in the House and 2 different committees in the Senate that we really focus on. The first is the Energy and Commerce Committee, which may not sound like it would have healthcare jurisdiction, but actually our provider status legislation that I'll go into in a few minutes actually would be heard by the Energy and Commerce Committee, and that is chaired by Congressman Greg Walden from Oregon. And what we call in D.C. the ranking member is always the highest member of the minority party. So in this case, it's the Democrats. So whoever is the highest ranking Democrat or minority member is the ranking member, and that's Congressman Frank Pallone from New Jersey. Underneath the committee, there are usually subcommittees, and both the Energy and Commerce Committee and the Ways and Means Committee have health subcommittees. You can see who these are led by here, by Congress. Both are from Texas. Congressman Michael Burgess, who was an MD before he came to Congress, and the ranking member is Gene Green, also from Texas. The Ways and Means Committee, you may also remember from your civics lesson, this handles tax legislation, but many times it also handles Medicare legislation since that deals with taxes. So that's a really important committee for us as well. You see here who the leadership in that committee is. Next slide, please. So we'll move across the Capitol to the U.S. Senate, and this also has the majority Republicans, and there are 46 Democrats and 2 independents that caucus with the Democrats. You have 2 U.S. senators for every single state. So while the House members are based on population size of the state, California has many, Montana has 1, for instance, but still, even if you only have 1 Congress member for a state, you still have 2 senators. So everyone has 1 member of Congress, 2 senators. Next slide, please. Here's the Republican majority leadership in the Senate. It's led by Senator Mitch McConnell from Kentucky, and here are the rest of his leadership team. Next slide, please. And here are the Democrats. This is a new Democratic leader. Senator Chuck Schumer from New York took over for Senator Harry Reid when he retired last year. So you may not be too familiar with his name because he's relatively new to the leadership structure, but here's the Democrats that lead the Senate. Next slide, please. The 2 committees over in the Senate side that we handle, that handles most healthcare legislation, is the Finance Committee. Again, it's not a committee that you would probably think, oh, that handles healthcare, but nearly all Medicaid legislation and most Medicare legislation goes through the Finance Committee, and that's chaired by Senator Orrin Hatch, and then the ranking Democrat is Senator Ron Wyden from Oregon. The Health, Education, Labor, and Pensions Committee, which is most commonly called the Health Committee, is chaired by Senator Lamar Alexander and has the ranking Democrat as Senator Patty Murray from Washington State. Next slide, please. Here's an infographic on on how a bill becomes a law. And I'll get into a little bit oh no, my computer just turned off. I'm sorry. My apologies. Let me get back on really quick. There we go. I apologize. Bills can be introduced in the House and Senate. Once they are introduced, they can go on to a committee, and that's where they receive committee approval. Once a bill is passed out of committee, it goes to either the Senate floor or the House floor. And if there are changes and differences in those two bills, they can go to a conference committee where the differences can be worked out. You may be familiar with this process right now because of all of the talk in the news about the health care bill that is moving through. You may be aware that the House passed something a couple of weeks ago and that the Senate has had it in their chamber and that they're working through their changes now. So if the Senate were to make changes, which it sounds like they will, if they can pass a bill, what it would have to do is it would still have to go back to the House to get approval, and then before it could go to the President for his or her signature. So, but this is a quick down and dirty graphic on how a bill becomes a law, and I'm happy to answer more questions on that as we move forward. Next slide, please. So I'll get into now to the number one piece of legislation that APhA works on and that y'all will be focused on during your Hill meeting next month. Next slide. So two bills. They're the same exact bill. They have the same language, but they have two different numbers. In the Senate, it's commonly known as Senate Bill 109, and that was introduced in January by Senators Chuck Grassley, Bob Casey, Susan Collins, and Sherrod Brown. If you'll notice, those are Democrats and Republicans. And so it's bipartisan legislation. Over on the House side, like I said, same exact bill, same exact language. We had House Bill 592 introduced by Congressman Beck Guthrie, G.K. Butterfield, Tom Reed, and Ron Kind. And the reason that this group of people are so important is that they make up members of the committees that I just went through. So there's a Democrat and a Republican from each of those committees that I just went through. So when we move forward with the legislation, there will be somebody on committee that is able to help shepherd that through the process. So these are not just by mistake members of Congress that we're introducing the bill. So next slide, please. So what does the bill do? You probably have heard a lot about provider status, but we may not know exactly what it means. The bills, like I said, are exactly the same. So we have them introduced in both chambers so they have a better chance of garnering support and to show how many co-sponsors we can get on both sides and have them move through the process, hopefully at the same time so they can move forward as one bill to the President's desk. But what the bill does is it amends the Social Security Act to recognize pharmacist services within Medicare Part B, which is the outpatient services section of the Social Security Act. The pharmacist services would be covered and paid for under Medicare Part B in medically underserved communities. This number at the top of the slide, which is how many co-sponsors we have of the bill, the House bill currently has 188 co-sponsors, and the Senate bill has 42 co-sponsors. Hopefully that number will increase by the time you guys are in town next month, and we'll definitely update you on that Friday morning to let you know what additions have been made. Next slide, please. So make sure before you go to your meeting that you know if your member of Congress or your senators have signed on as a co-sponsor. You can look this up on congress.gov, and you can either type in S109 or HR592 there at the top, and you can see who are co-sponsors. You can see the text of the legislation. It's a really short bill and hopefully pretty self-explanatory, but from there you can learn if your members of Congress or senators have signed on. If they're a co-sponsor, the first thing you should do when you go into your meeting after introducing yourself is to tell them thank you for co-sponsoring the bill. They may still want to talk about it and learn more about how it would affect you in your fellow pharmacists post-graduation in practice, and so you can talk about that. We'll get into that in just a minute. If they are not a co-sponsor, that's what a lot of this webinar is about. So we'll talk about how you can lobby them and get them committed to co-sponsoring the bill before the end of your meeting. That's the goal of your meeting. Next slide, please. So the bill, again, it will allow Medicare beneficiaries in medically underserved areas to access pharmacists for the services that they provide. It's limited to pharmacists licensed in the state where the Medicare beneficiary lives, and it's limited to the services you are able to provide under your state scope of practice. It does not expand state scope of practice. That can only happen on the state level. So nothing in this bill would change state scope of practice. And another important part of the bill is that it reimburses pharmacists at 85% of the physician fee schedule. This is something that, if anyone asks, we modeled this after what the nurse practitioners did when they moved their provider status bill forward several years ago. Next slide, please. We believe that the bill would increase access and it improves outcomes by enabling pharmacists to provide these patient care services that you learn and are trained to do through school and through your rotations. The legislation does not require Medicare to cover any new services. It's only, again, the ones that you can provide in their state scope of practice. It is not, the legislation is also focused on patients who are medically underserved. And what this would include, if you're familiar with the way that medically underserved is designated, the Department of Health and Human Services designate areas called medically underserved populations, medically underserved areas, and health profession shortage areas. And so these are all go through an algorithm with HHS that they determine what these are. So it's not something that's arbitrary to the APHA to determine. Next slide, please. The bill promotes cost-effective health care by increasing access and opportunities for early intervention and cost-effective savings. You guys know all about that from what you're able to do and what you're able to see and learn and how you're able to help your patients. There's been a lot of move in the healthcare community where it comes to Medicare to go to value-based care. So we believe that this legislation would certainly fall in line with that. I've mentioned many, many times that the bill has strong bipartisan support, and that's something that you should emphasize as well. There's not a whole lot of legislation, as you know, that's bipartisan out there these days. So this one's important, and this one's got a lot of support. Some facts that you may want to bring up in your meeting are that that many, many Americans lack adequate access to primary health care, and at least 45% of Americans have at least one chronic condition, and 27% have multiple chronic conditions. So if you put that together with all of those that aren't able to access care, we believe that pharmacists would be able to meet that need. 91% of Americans live within 5 miles of a pharmacy. So you probably know this far better than I do, but healthcare staff on Capitol Hill don't know this, that patients are much more likely to go to their pharmacy than they are to their doctor. So if you guys could be that access point, would be very critical in helping better outcomes. Next slide, please. You can talk about your education. That's something that many people don't know about either on Capitol Hill. So really focus on how many years of education you have, the continuing education that you will be required to have following graduation, and all the training that you receive, and how I think it's very compelling how you guys have to do rotations for your last year of school and how you have been integrated into the system before you even have your license. Point out that you have more medication-related education and training than any other healthcare provider, and that you are the main point for patients to be able to get access to information about their medications and how they can take those more accurately. Next slide, please. So some of the examples that would be covered if this bill were to pass and that you could be reimbursed for by Medicare would be blood pressure monitoring, immunizations that aren't covered in Medicare Part D, cholesterol testing, management of chronic conditions and related medications, so medication therapy management, point of care testing, which you can do in some states, and transition of care services. Next slide, please. So another point to make in your meetings could be what strong support in the pharmacy community this piece of legislation has. We're a part of a coalition that includes about 50 different organizations. If you actually will advance it to the next slide, I'll talk a little bit about the steering committee. But these are just some of the organizations that are really heavy hitters in the coalition. But on our steering committee includes the Association of Health System Pharmacists, the chain drug stores, the Community Pharmacists Association, and Walgreens, along with APhA. And from what everyone has told me, that this is really the first piece of legislation that the entire pharmacy community has come together on. So I think it speaks volumes to be able to say that not only is there no one opposed to this bill, but that all of us are really working very hard together to get it across the finish line. Some other really heavy hitters on this slide outside of the pharmacy community are the National Rural Health Association and the National Consumers League. Those are two groups that don't have to take a position on this legislation at all. Like, it's outside of what they do on a normal basis, but they saw the importance in pushing it forward, that they went out and endorsed the bill and are part of our coalition. So I think that those are two that I really try to point out a lot. Next slide, please. Our coalition has put together a lot of resources. You can see the website down at the bottom of the page. I'll have it again at the end of the webinar, but there are a lot of resources on there that I really advise you to take a look at before you come to town. We will have fact sheets for you to take to Capitol Hill with you that will include these state-specific fact sheets, but also a more broad provider status fact sheet. But it's a good idea to get to know what your state looks like in the medically underserved populations. This one, for instance, says California, 51 of the 58 community or counties there are considered medically underserved. So it's a good thing to know that. There are some really specific how many pharmacists provide care in the state. So I really encourage you to go to this website and take a look at it before you come to town. Next slide, please. So I know I've been very repetitive. I hope that that's the way I learn. If I hear it over and over again, I know I've said the same points again, but I'll say them one more time, just so hopefully you get them. And if you didn't understand them, you'll be willing to ask questions. So again, the bill will enable Medicare beneficiaries in medically underserved areas access to access to pharmacist services in Medicare Part B. It does not expand state scope of practice. Pharmacists will be reimbursed at 85% of the physician fee schedule. And the bill promotes cost-effective health care by increasing access to and opportunities for pharmacist-provided services. I apologize, that did not finish, but it's supposed to say pharmacist-provided services. Next slide, please. Talk about your education and your training and how well you are equipped to provide these services to Medicare beneficiaries, and how willing you are to provide these to Medicare beneficiaries. You want to be able to use your training that you received in school. I've said this a million times, but the bill has strong bipartisan support and all the support of the pharmacy community, and no one has outwardly opposed the legislation. We are not aware of anyone that has opposed the legislation. And the most important thing, which I haven't mentioned yet, is to tell your story when you're on Capitol Hill. Personalize what you will tell people. If you have had an experience on rotation or seen an experience that you've seen how you've been able to make a difference in a patient's life, if it's through a cholesterol screening and you've been able to get them to their doctor and advise them, they have higher than normal cholesterol. If it's been through medication therapy management, and you've been able to take them from 30 medicines down to 6 medicines a day, then that's a great story. If you need help with stories, I've got plenty of examples. I hear from students. I read in our APhA publications. I'm happy to give those to you. I have some that I really, really like. Most of them have to do with medication therapy management, but not all of them. So before you come to DC, try to think of a story of how you have touched a patient, because that's what Capitol Hill staff and legislators don't really understand. They look at pharmacists as dispensing medications. They don't understand or know what all you can and are able to do. So make sure that you personalize your story and try to connect with them on that. That may be my last slide, actually. Oh, no. Sorry. Other legislative issues we'll touch on in the next webinar are healthcare reform. Obviously, that's completely up in the air. We will probably know more by the next webinar. Drug pricing is a really hot topic. The president put out an executive order on that on this past Friday. And then drug importation is something we've been pretty active on here at APhA. So we'll touch on those lightly so you're prepared if Capitol Hill staff or legislators ask you about those questions. But wanted to do a deeper dive tonight on provider status. Next slide, please. Okay, here's the website again, and you can also send your fellow students who aren't able to come to DC. They can certainly send a letter to the legislators if they visit this website, that you can find more information with those fact sheets and such that I talked about earlier. Next slide, please. There we go. Do you want me to take questions now or wait till the end?
Actually, we're going to.
Go ahead, Jason.
Oh, good.
We can take questions now on anything related to the legislation, any of the talking points that you would like, anything along those lines. The part after this, we're going to tell you a little bit about scheduling your visits, what's going to happen on that Friday, but we'd be happy to answer any questions now.
No questions?
Doesn't look like we have any pertaining to this section, at least.
No worries.
All right. Well, thank you, Alicia Kerry. That was an excellent overview there of provider status and the structure of Congress. I hope you all gained a good deal from it. I must say the Policy Standing Committee did a great job with that infographic that was presented a while back, something they started last year and came to completion this year. So next up, we have Grace Beck, who is our summer intern at APhA headquarters and also our Region 5 delegate. She's going to go over setting up your meetings on Capitol Hill. So Grace, take us away.
Thank you, Jason. Good evening, everyone. So today I'll be quickly talking about how Capitol Hill visits are being scheduled at this point. So everyone who signed up for a Hill visit has been assigned to a group. We're getting everyone at least in a team of 2 or more, so that people who have more experience are able to help out first-timers and people who would like some more support on their Hill visits. So all of the group leaders have been designated and emailed, and group leaders are responsible for scheduling Hill visits. And once appointments are made, group leaders will email group members with who, when, and where the Hill visits will be held. If you receive an email from a fellow student pharmacist with this information, please make sure to save this. This will be important information once you arrive in DC on Friday. So in terms of the order of visits, the Senate visits will be scheduled first, then the House of Representatives visits. And if you haven't received any emails from me, please go ahead and check your junk mail folders to make sure you haven't missed any emails. And anyone who has not heard from the group leader by July 3rd, please contact me at the email shown on the screen. Next slide, please. Okay, so this is a quick overview of what to expect on the day of Capitol Hill visit. So on Friday, July 14th, before Hill visits on Friday morning, we're going to have an early start on Capitol Hill. So if you go to SLI.pharmacist.com and you'll take a look at the schedule, you'll see that the start time is 8 a.m. on the Hill in the Rayburn House office building in rooms 2043 to 2045. That means if you're at the Washington Plaza Hotel, ideally you would leave by 7:15 to 7:30 to depart for Capitol Hill. The expectation for dress is business attire and white coat. And Alicia Kerry will lead a Hill visit briefing in the Rayburn office, again at 8 a.m., and answer any outstanding questions. Following that, we'll have a Q&A with members of Congress in the same rooms in the Rayburn House office building from 8:45 to 9:30. After that, from 9:45 to 12, we'll have Hill visits. During the pre-Hill visit portion of Friday morning, we'll have packets to leave at Hill visit. And if you're flying in on Friday morning, luggage may be dropped off in room 122 of the Kennan House office building. Any last-minute questions can be addressed by APhA staff at this point as well. Next slide, please. So during Hill visits, as I mentioned before, they'll be occurring between 9:45 a.m. and 12 noon. Expect each visit to be about 15 to 20 minutes. And as Alicia Kerry mentioned, legislators and staff members really enjoy getting to hear from student pharmacists, and they are very willing to listen to what you have to say about HR 592 and S109, as well as your experiences as a student pharmacist. So really start to think about what anecdotes you can bring to the visit. You want to set aside at least 20 minutes to walk between buildings, and keep in mind that DC weather is quite hot and humid, so adjust for that as well. Expect to go through security at each building. And for visits, a nice touch would be to bring your business cards, especially if you are a constituent of the legislator you are meeting with. Finally, the packets that you picked up earlier in the day, you'd want to leave with offices, and as Alicia Kerry mentioned before, these packets include state-specific materials. Next slide, please. Finally, during Hill visits, if you run into any problems between Hill visits, APhA staff are available at room 22 of the Kennan House office building to answer any outstanding questions. After Hill visits are over, there will be a white coat photo that will be taken at 12 p.m. We'll be meeting at the Capitol Visitor Center. Next slide, please.
All right, so do we have any questions for that segment? No hands are raised. Okay, well, if there are no questions, we'll proceed forward. You can continue to type your questions into the box, and I'll ask one more time after I go through a few reminders here. All right, so our next webinar, part 2, will be on Wednesday, July 12th at 8 p.m. Eastern Time. And during that webinar, we'll just go through some of the logistics of conducting the Hill visit. So the arriving early, proper exchange of information, following up, and then expectations. What should you actually expect when you arrive on site? What should your goal be when engaging? How to really bring out that personal experience and tell your story, remembering to begin your legacy. And then we'll also go through a sample visit. So myself and the Policy Standing Committee will run through a mock script and updates on messaging. Please continue to look out for any correspondence from Grace. Once again, she's done a phenomenal job at APhA headquarters, keeping everyone engaged and informed leading up to SLI. Last but not least here, we have the APhA Good Government Student Pharmacist of the Year Award. So nominations are officially open for the 2018 award. Just a quick overview, this recognizes a student pharmacist who has successfully organized student pharmacist grassroots activity. And if you want to get further information such as criteria, nomination process, please visit pharmacist.com. We can chat more about it at SLI. So once more, do we have any further questions? Seems like we've saved a little bit of time for tonight. All right, so we do have one question just came in from Catherine. So we are assigned groups for our Hill visits. We do not have to personally reach out to our legislators to schedule the visits ourselves, and that is correct. So you are assigned to a group. Your group leader has been contacted by Grace. He or she will follow up with you in the next few days here once the logistics have been planned out and the correspondence has been made with Grace and myself. Does that answer your question, Catherine? And are we wearing our white coats for the visit? So you can just carry a white coat in your hand, and then afterwards we'll take a picture at the noon hour with our white coats on. All right, and that was Melody. Does that answer your question as well? Let's see. So no hands are raised. Perfect. So, well, okay, I want to turn it back over to Alicia Kerry. It's like, Alicia, you might be still muted there.
I apologize. Wow, that was a rookie mistake. Thanks. I had talked away. I just wanted to say thanks for your attention tonight and for joining. And please don't hesitate to contact Mary Ryan or Grace or Keith or any of us on staff with questions you may have about Capitol Hill or coming to DC. We're happy to be a resource. But thank you for your attention tonight.
All right, so you guys can get back a few more minutes in your Monday evening. Here's some contact information here. Please feel free to reach out if you need anything. Everyone, you have a good night.